This is Dr. Daniel Paul, orthopedic surgeon with Easy Orthopedics, and today we're going to talk about what is compartment syndrome. If you like this video, we put out new content weekly, so please like and subscribe. So compartment syndrome is one of the things that falls into orthopedic emergencies. Like, you can break your leg and that's like orthopedic urgency, meaning like you need to get it fixed in the next day or two. Orthopedic emergency, like with compartment syndrome, means you need to take care of it as soon as possible. There's not too many in the world of orthopedics, but compartment syndrome is one. So what is it basically? So a lot of the muscles in your body, especially in your extremities, essentially, are surrounded by sort of something called a fascia, which if you looked at it, is like, it looks like shiny and white, and it's like a thick stocking. So picture the muscles like in your legs surrounded by a thick stocking that you couldn't really stretch. And compartment syndrome happens when there's damage to the bone or the muscle, and it causes a bunch of blood to just dump inside of those compartments. Internal bleeding, you could call it, but not in like the stomach or the chest, like into the arm or into the leg. And what happens in that case is that pressure gets so high in those compartments that now the muscles can't get blood flow. And when they can't get blood flow, they end up dying like anything else in the body. So compartment syndrome is basically when there's some damage, blood leaks out into these compartments, the muscles can't get blood flow, and then the muscles die. So if you leave it alone, what happens is the whole leg or the whole compartment will die, and it can then gets infected, and somebody can die from that if that infection goes to the rest of their body. But in the best case scenario, you're losing significant function in the limb and possibly losing the limb itself. So that's what compartment syndrome is. The key is to diagnose it quickly, which I'll talk about in my next video, and then also to you have to release the compartment. So the surgery to do is you open up the skin, you find the fascia, and you make an incision in it, and the muscles, if it's true compartment syndrome, will sort of balloon out, and that allows them to get blood flow, and then they don't die. And then later on, you can go back and close the wound. And there's different compartments all over the body. When most people get compartment syndrome, it's in the lower leg, but you can also get it in the thigh, you can get it in the hand, you can get it in the forearm, you can get it in the foot, and you can even get it in the glute area, although extremely rare. Most commonly, it's usually in the tibia, and it's usually from like a broken tibial bone. But stranger things have happened, and you can see it in other instances. So I hope I was able to answer your questions about what is compartment syndrome. If you like this video, again, we put out new content weekly, so please like and subscribe. If you have any questions I didn't answer, feel free to leave them in the comments below, and I'll do my best to respond, but I can't give you any specific medical advice about your condition over YouTube, because this video and all my videos are for educational purposes only.